Hello, welcome to week 2 of this class. Um, my name is Natasha, and for this week, I'm going to be sharing to you summary for my summary for my practicum. So for my week 2, my main point was to provide a summary of content related to projects obtained from policies and procedures. Also, to provide a summary of staff feedback following interviews and provide summary of preceptors' feedback. So before I tell you the summary of my outcomes and evaluations, um, I presented this to my preceptor, um, and I came up with a nest-driven program to reduce CADIs. My preceptor thought it would be a good idea to add main purpose of this project, which I think I came up to engage my nurses in continuous education, to educate my nurses in areas where they felt shut off, to execute, which is to get administration and people of higher powers on board with this, and then to evaluate our current policies and procedures, and then to add to it what I think should be done. So following my nursing interviews, I had the opportunity of interviewing 3 nurses. It was actually about 4 nurses, but for purposes of this, I included interview of 3 seasoned, actually 2 seasoned nurses and a brand new nurse in this um, project. Based on the interview that I had with these nurses, my main questions to these nurses was, do you know how to put in the Foley? All of them did know how to put in the Foley because, yes, they did learn it from school. Do you know what the policy of this hospital is as to what Foley is? The seasoned nurses knew it, but one of them didn't know where to locate the policy. My third question is, what does the policy say in reference to hygiene? None of them knew about that because the policy doesn't really have a statement on hygiene. What does the policy say based on justification? It was funny how 2 seasoned nurses says the justification is based on doctor's orders. The other one said justification is based on whenever the policy says, and one person said they did not know what this justification said. So what does the policy of Lord says right now? The policy of Lord right now is a single document that says on how to prevent caries and what treatment protocols they have there. The policy also says RN has to complete an assessment after an insertion in the power chart. Documentation, the, um, the document also present documentation and assessment of all Foleys every shift unless otherwise included. This is when there is an inconsistency because there are certain shifts that have nurses where nurses are required to work 12 hours, and then on other units, nurses are required to work 8 hours. So here on units where nurses work 12 hours, patients over there have the chance where nurses assess their skin area or the Foley CAT 3 times a day, whereas in areas where nurses work 2 times a day, this assessment is done only twice. That is very inconsistent, and that was another thing that I added to my new power chart documentation. It did have a justification for removal, whereas it says after if a Foley is inserted for retention, it should be removed after 72 hours. And if a patient is unable to void on their own, Foley would be reinserted until doctor thinks it's okay to do so. So one main issue, one or three main points where I want added to the documentation part of um, this of my power chart is um, nurses and aides should be able to document input and output when a Foley is inserted, especially based on retention. This would give doctors or healthcare members a clear idea of how much the patient is taking in and how much the patient is able to bring out. Prior to this, nurses should also be given the advantage of putting in input and output and scanning the patient often to see if a Foley is actually needed for this Foley. Um, when the Foley is inserted, there should be documentation of what the size of the catheter is, what the skin assessments looks before, and each time it is assessed, the urine that is coming out, what is the color of it? The color of the urine would say if the patient is being hydrated or not. The order of the unit, and a foul order of the urine would alert a nurse or the aide or whoever is um, emptying the Foley at that time that if there is some infection going on or why does the urine smell that way. Patient response. Sometimes when a Foley is inserted, a patient will say they feel discomfort, they feel pain. Nurses should be able to have a place in the chart to document how the patient responds to that Foley. If a Foley is inserted and it continues to bring much more discomfort to the patient other than its therapeutic use, the nurse should be able to document this and relate it back to the doctors to let them know so that a different intervention will be done. When a nurse suspects signs of infection, um, there should be a place where they can document it and also report it to the infection disease or put in a consult so that someone else in an infection disease specialty can see the patient. So one main thing that another thing that I think should be added to this is medical devices related to CADIs. This right now is not part of it, but I think nurses should identify equipment and where it's being touched off often. The use of aseptic techniques when inserting the Foleys. Consider changing the urinary system to prevent events of an infection, obstruction, break or leak in the closed system. We should never change the bag routinely. I added this because one of the nurses that I interviewed actually said that the bag should be, she thought it was part of the policy for the bag to be changed routinely. This is a no, because changing the bag routinely can actually cause bacterials at the site. Cleaning tubing with soap and water daily. I added this because one of the nurses brought up a question of what if the patient is independent and they wash themselves? How well do we know that the patient is cleaning this? And this is when we can educate and have the patient re-demonstrate to us that they are doing this technique or they are doing this technique aseptically. Um, One main important point is do not remove any seals between the catheter and the drainage tube. So one of the nurses had brought up that sometimes the catheter may not be flowing well because there is a seal that is being attached to it, and that is what causing that infection and could be removed at that time. So for my second week, I would say it was successful. However, I was kind of in shock to know that we have like seasoned nurses that have been precepting newer nurses day to day, and they did not have a clear understanding of how to properly care for a Foley when it's being inserted. So this is a summary of my week 2, and I look forward to seeing what week 3 will bring up. Thank you.